Okay. Got everybody here. At this time, we have a count of 64 participants. All right, Anna, when you're ready.
Good afternoon, everybody. My name is Anna Grassley, and I am coming from Monroe here. I work at the Community Action Agency in Monroe County, and we actually have funding for your county in Washtenaw for utility assistance. We've had it probably, I think this is our fifth year in a row of having it. So I just wanted to let you guys know what was available. We have MEP assistance, and I'm sure you've heard of MEP through, Salvation Army carries it, True North carries it for your area as well, and so do we. And we are willing to drive to your area for anybody that is having issues with getting their utility bills paid. I have clients that contact me all the time from your area at least every year. I can have three that I can think of that I help every year with their gas and electric bills through DTE. So we meet anywhere that is convenient for them, that as long as it's public. There for a while, we were meeting at the Learning Center. That is still something that, would be cool to set up again if we got our numbers back up in your area. So let's get to it. So who's eligible for MEEP? How will clients have access to MEEP through MCOP? What is the process for household seeking utility assistance? We can't do account holds. I'm not going to get into that a whole lot. I'll probably skip that slide because I get a lot of calls. Hey, can you put a 30-day hold on my account? I'm going to get off tomorrow. No, I can't put it on a hold on your account unless you're my client and you're coming to see me. So just to give you guys a heads up, that's some of the things that we field here. So, who is eligible for MEEP assistance? You must have an approved SER, so that's state emergency relief through DHS, since October 1st. So, say they applied October 1st and they took the whole 850 per commodity, they're still eligible for this program. Okay. They just have to have that old decision notice from that date, and then we can pay whatever they have minus the late fees and home protection plans. Those are two things that we cannot pay. So just a heads up there. If you're looking for navigators in your area, I'm not sure how many of you guys are actually navigators. I am one as well. We could help people apply for SERs too if they're going to set up an appointment and have them sign the paperwork while we're with them. And then once they get that approval, process everything. That's something that we can do as well. One thing, people get very confused about the approval process of the SCR. Why am I going to apply for SCR if, you guys have to have an approval? Why are we doing all this? And well, it's because it's an income qualification, unfortunately, that, they have set forth for us. So they're trying to stretch payments along for as much as they can, using LIHEAP funds and MEEP funds together, which, I can't blame them for trying. The MEEP cap has went up this year. Last year it was $3,000, and the year before that it was $2,500. And when I first started, it was 2,000. So now we're at 3,500 a year. So that's from October 1st until we run out. So we have not ran out. So please, if you guys had the opportunity to send me people, I greatly would appreciate it. Um, Next thing is, so what does the SCR look like? So this is a portion of SCR that we clipped out. As you can see, it states, you're approved for a certain amount through DHS, and then you have a co-payment yourself, and then there's your total. So if this could be the one that you bring me, say you have an appointment tomorrow and you're coming to see me for MEEP, you can bring me this old SER from the first of your dates covered, and I can pay for your new bill. So that's how it works. It's an automatic qualifier for income, which is kind of nice. Um, yeah. So, and obviously SCR works with gas and electric, both for in DTEs in your guys' area, as well as deliverable fuels. We have worked with a couple people in Milan for deliverable fuels as well that are in our area and yours. So how will clients have access to meet through MCOP? Basically, we're going everywhere. So I have had clients in Hillsdale contact me from 211, and I have driven all the way out to Hillsdale. Doesn't bother me. Like my thing is I want to help as many people as I can with our funding, and we need to get it spent. So, I mean, it's already the end of February and crisis season's almost over, and we still have quite a bit left. So it would be nice for some referrals to come my way. Um, yeah. And one thing is, MEP assistance should not be put into the Encompass system as I don't have access to any of that. I like to make sure I point that out. Um, Also, there are limitations. If a client has had help through Salvation Army or True North, they cap out, they cannot come to us. Okay, because that's double dipping. They kind of, the Bureau kind of frowns upon that. So just to give you guys a heads up. So, I mean, that's pretty much the gist. If you guys are navigators, I'm not sure if you are, help your clients apply and then call me. If your client has one from October and they need assistance again, call me. I have no problem getting to your clients in your area. So basically, what happens is if I meet a client somewhere, I have them sign the documentation, and then there's some wraparound services that I do with them, like budgeting, energy education, and stuff like that. There are referrals that I have too, as well, for your guys' areas. Um, yeah, so please send me people. So when not to refer to people to me. So a prorated amount is something that I have came across probably a handful of times in the past 7 years that I've been here. Proration basically means that somebody in the household is not a U.S. citizen. MEP is not allowed to pay that, unfortunately. So that's not something that I can do out of my funding. If an application has been denied due to being over income, I cannot help them. Um, if they've hit cap for the year and it says you have hit cap for the year, I can help them at that point because they've already had assistance for this year. When I say this year, I mean fiscal year since October 1st. DHS is supposed to be placing holds on clients' account when the SCR is being determined for 30 days. So I'm not allowed to put holds on accounts unless I have a client, like I said earlier, they're mine. I have an appointment set up. Um, yeah, so this is my number. 734-241-2775. My direct extension is 202. It's pretty easy to get to me. And if you have any problems getting to me, there is my program director. Her number is on there as well, and she'll make sure I get a message. So let you guys copy that down.
Okay, Anna, we have a couple of, we have a question here. First, we
Uh-huh.
have Yvonne mentioning that Housing Bureau for Seniors is a navigator. And we have a
Okay,
question
that's good.
here from Stacy. Are you able to come to people's houses? I work with homebound seniors.
I will come to their houses, but I prefer to not go into the house because of COVID. So if they could get to the door, that would be awesome. If not, then I will figure something out. If I have to go in, I'll go in. I don't, it doesn't, I get it. I just try not to. I have a little one at home, so I try to set barriers, you know. Um, One other thing that I was thinking of that popped into my brain, we were talking about, um, what was the question before? Oh, navigators.
Mhm.
If you guys have a client that you're going to refer to me, you can give them my navigator ID that's up here on the screen. It says CPID. That's my navigator ID. They can add me as their navigator, and then I will have access to their letters. It'll make my job a little bit easier to get their letter because I can just pull it up and then meet them and have them sign the paperwork. So, yeah. So that's my presentation. Quick and easy. It's pretty much the same as Salvation Army and True North. It's the same funding pot, so we can't mix it. So if they have it, I can't use mine if they cap out. But please send me people. I need calls and I have funding in your area and I want to spend it. Thank you.
Thank you, Anna. That was fantastic. And yeah, and just to reiterate, these don't go through barrier busters through Encompass. You would go directly to Anna. Okay. Any last minute questions? You want to unmute and shout out a question?
Yeah, I had one. Excuse me. This is Carol from the Manchester Community Resource Center. Just wanted to verify. I mean, we're Washtenaw County still, so you would come to Manchester for
Yeah.
this as well. All right.
We actually
That's a
have
haul.
Jackson. What is the
Okay.
county that is it Jackson?
We're
Manchester's in Jackson?
no, we're Washtenaw County. We're
Yeah,
Washtenaw
but
County.
isn't
So
part of you guys in
mm-mm.
Jackson? No?
No.
Okay. No, I went to school in Adrian and I had a professor
Ah.
that was in Manchester that lived there. So I get my counties confused over there, but we serve Jackson, Lenawee,
Okay, perfect.
Hillsdale,
Yeah.
Washtenaw. Yeah, so
Awesome.
anywhere anybody goes, the GPS will take me.
Gotcha. Thank you.
Yeah.
Okay. Anybody else?
There's a question about whether they serve Livingston.
Unfortunately, we do not serve Livingston. Livingston has their own, or either Wayne Metro has it. Because when this program came out, we were asked to take so many counties in our area and around us. So Livingston, unfortunately, was not one of them.
Hi, I have a quick question. Can you guys hear me?
Mm-hmm.
I'm Samara from Representative Wilson's office. I just wanted to know what areas don't you service, just so I know for
Oh,
finance.
I only can serve Monroe, Jackson, Lenawee, Hillsdale, and Washtenaw. That's it. That is all our grant allows us to do.
Can you say that one
If you
more
have
time for
somebody,
me?
pardon?
Can you say that one more time for me? Monroe, Jackson, Washtenaw.
Yep, Monroe,
Mm-hmm.
Lenawee, and Hillsdale.
Okay. Thank you. I
And
appreciate it.
if you need somebody that serves the other counties, like Livingston, for example, you're going to want to try True North or Salvation Army. And Wayne Metro, like I said, they picked up quite a few counties too as well.
Cool. Thank you.
Hi, Anna. I don't
You're
have a
welcome.
question. Lori Lutumsky from Ypsilanti Township, but we
Hi.
have a network center that has free space available for nonprofits and folks who need to come up here and get office space to meet with
Okay.
people. So I'd be happy to chat with you about that and how to get you access to the building. So if you did
Oh,
need to meet with somebody. I
yes.
just wanted to throw it out there to you that we have a small network center at Homes and Harris Roads in the township.
Oh, that would be perfect. Thank you, Lori.
No
Can
problem.
you put
And
your phone number in the chat box for me?
I can put it in the chat box, or I say I wrote yours down so I can give you a ring too.
Okay, that would be perfect. Thank you. Anybody else? If you have questions about anything or something pops into your head after the meeting, just call me. If I'm not at my desk, leave a message. I'll get to you, I promise.
Fantastic. Okay. So if that's it, we've got Kara. I saw you come in. There you are. Do you want to go ahead and run your PowerPoint, or do you have that ready to go, or would you like me to run it for you?
If you could run it for me, that would actually be great.
Okay, give me a second. I have it here. So the way I'm going to do this, okay, there it goes, is I'm going to do it, and then you want to just cue me to change to pass it on.
Yeah, that'd be great.
All right, I am going to share screens. All right, how are we doing?
All right. Hello, everyone. It's been a while since I've been to this meeting, but if I don't know you already, my name is Kara Painter. I am the Coordinated Entry Supervisor here at SOS Community Services. And today I'm going to be presenting on our coordinated entry services that we offer here at SOS Community Services, which are homeless family assessments, homelessness prevention, and shelter diversion. So just want a disclaimer that this presentation is not on coordinated entry in general. If you have questions about coordinated entry, I can try to answer them at the end. But just a disclaimer a little bit that when Hawk left the Salvation Army last year, Hawk actually was broken up into several different agencies. So it's now the Office of Community and Economic Development, which is where the call center is. SOS Community Services handles homeless family assessments, homelessness prevention, and shelter diversion. And Delana Center, SOC, serves individuals without children. And Avalon Housing has a role in coordinated entry as well. Next slide, please. So starting out with homeless family assessments. So these are for our families here in Washtenaw County that might be experiencing homelessness. So just to kind of talk about eligibility really quickly. So we consider a household is anyone that has minor children under the age of 18, with the caveat of if there is an 18-year-old in the household and they're in high school, we still consider that to be like a minor child. And then, or a pregnancy, that's also considered a family for purposes of eligibility. They must be here physically in Washtenaw County. Little caveat there also, if a household temporarily has to leave the county to be hoteled or something like that, that's fine too if they were here previously. And they also must meet the HUD Category 1 definition. It's up here on the screen, but just to briefly summarize, that they would have to have a primary residence that is a place not meant for human habitation, such as they're sleeping in the car, they're sleeping outside in an abandoned building. Part of the Category 1 definition could be that they're in a shelter or that they're being hoteled by a government or charitable organization. If someone is paying for their own hotel, or an acquaintance is paying for it, a sister, a brother, unfortunately, like while we understand that their need is still emergent, they don't actually meet the HUD Category 1 definition. Next slide, please. So this is just kind of the process. So when a client is experiencing a crisis, when they're experiencing homelessness, they would first want to call the Hawk call center. And they actually have the initial conversation with clients over the phone. They complete just a brief intake with them, and they're doing the initial screening for eligibility, and they schedule an appointment for the client with us through a shared calendar. Then the client is called for their appointment over the phone with our staff. So we're not doing any in-person appointments right now. Everything we do is over the phone. During that appointment, we would then confirm eligibility. So we would confirm that they're still experiencing homelessness, that they still meet that Category 1 definition. And if they do, we complete some paperwork with them over the phone. And then their information gets added to a prioritization list. And they are instructed to call into the Hawk Call Center 1 time per week to update their living situation. Next slide, please. And so just kind of talking about documentation, I just really wanted to note that documentation is not required for a family to complete family shelter assessments. There are no required documents. It should not be a barrier to them completing the assessment. However, it is helpful for a household to have a homeless verification letter prior to or after their homeless family assessment. And the letter should include the following. It needs to be written by a third-party provider on agency letterhead. It should include a client's name, date of birth, how the case manager knows the client and how long they've been working with them, and specifically states where the client is sleeping at night and how long they've been sleeping there. And the thing that HUD and MSHA really want us to have is that it states that the client is currently in Washtenaw County. And of course, signed and dated by the person writing the letter. And if you're ever helping verify homelessness through this letter and you need help writing it, or you want a template, please feel free to reach out to me. I'm more than happy to help. Next slide, please. And then some of our limitations. So homeless family resources are almost never immediately available, and it can often be several weeks to several months before a family is matched with a resource, and that's done through a prioritization process. So it's not actually first come, first serve. It's done through a prioritization process. We're required to complete the prioritization process per HUD. Households that are doubled up or couch surfing are not eligible for a homeless family assessment. While we understand that those folks are precariously housed and are definitely in need of some assistance, they actually don't qualify for a homeless family assessment per HUD. And again, we're limited by the funder here, which is HUD. Households from out of county are also not eligible for a homeless family assessment in our county either. The call center would screen those folks out. Next slide, please. And moving into homeless prevention. So this is going to be anybody who's at risk of eviction or is precariously housed. So the eligibility for this, the income guidelines are going to really vary depending on funding. The funding that we currently have access to is 30% of area median income. So I don't have a chart with me currently, so I don't know it off the top of my head, but if you're ever interested, I can definitely send you that 30% chart. Clients must also be in eviction proceedings. So at minimum, they must have a court summons and complaint. So while we really appreciate clients being proactive when they fall behind on their rent, because of the limited amount of funding that we have access to, we just have to have a way to prioritize these cases, and the best way that we can is by urgency. So we do require that clients have a court summons and complaint at minimum. And this is in line with what the Department of Health and Human Services requires for the state emergency relief application as well. They require that the same documentation. Households must reside in Washtenaw County, so their court case needs to be filed here in Washtenaw. Any and all adults that are on the lease must be screened by us. And some funding does require that a household unit passes a habitability inspection. However, we don't have access to that particular funding at this time. Funding also must be able to resolve a client's current ledger balance. So if the maximum that we can assist a client with is, say, $2,000, $3,000, and they owe $10,000, if what we're assisting with isn't going to bring them back to a zero balance, we are not going to assist. Because essentially the goal is to keep them housed and to take them out of that crisis. So if what we're paying isn't going to resolve that crisis, then we're not utilizing funding in the best possible way. So we wouldn't, we try really hard to come up with solutions to the best of our ability to keep people housed, problem solving by using settlements, encouraging conditional dismissals in court, encouraging payment plans with landlords, but sometimes if the landlord is unwilling, there's not a whole lot that we can do, but we try to the best of our ability to problem solve all of our cases. Next slide, please. And just kind of our process for prevention. So again, Hawk Call Center screens households for eligibility and schedules the appointment. we complete the prevention assessment over the phone. And then once we confirm eligibility over the phone, documents are then requested from both the client and the landlord. Then once all the documents are received and the case has supervisor approval, funding is requested. Typically, the process takes up to 2 weeks, sometimes more, depending on when documents are received, but we try to keep it around 2 weeks or less total process. Next slide, please. So just talking about documentation for homeless prevention, documents will really vary depending on the funding that is used, but some common documents include the lease and the ledger. Proof of income, typically we're going to ask for 30 days of consecutive income within a 60-day window for every single adult on that lease. Housing termination documents, which would be their eviction documents, so court summons and complaint, a judgment, whatever they may have from the court. And a W-9 from the landlord. We always want to verify ownership with whatever property we're assisting with. And then some funding streams, but not all, require that clients apply for the State Emergency Relief, SER, through DHHS. And typically they don't require like one way or the other that they have an approval, but they just require that they apply and receive a decision. Next slide, please. And then just some of our limitations. So right now, I only have 2 staff taking prevention appointments. That's what we're funded for the entire county. So our prevention appointments are currently booked out around 7 to 8 weeks. Unfortunately, there's just nothing we can do. We don't have capacity beyond what we're already doing, which is really, it's been very challenging. And funding availability is limited. So currently, households are eligible for $2,000 per household in prevention funding and $3,000 if the household's rent is subsidized. So if they have a voucher or they're in income-based housing. And households are eligible for up to $5,000 a year in prevention funding here in Washtenaw County when it is available. So right now we're kind of limited in what we have available. But yeah, that's per rolling calendar year. So it starts from the date that they received assistance. So if a client received assistance, say March 1st, 2024, they're not eligible. If they received $5,000 cap, they're not eligible again until March 1, 2025. Next slide, please. And so I'm really excited to be able to talk about shelter diversion with all of you today. It's a newer program that we have here at SOS. We're actually a part of a pilot program through MISTA. I think we were one of 5 communities that were selected for this pilot. It was a pretty competitive application. So we're really excited to be able to practice shelter diversion. So we have diversion, but also the Shelter Association, Delana Center, also has a part of this diversion grant as well. They practice with individuals. We're working with families here at SOS. So what is diversion? It's an intervention designed to immediately address the needs of someone who has just lost their housing and become homeless. It's a client-driven approach with the goal would be to help the household find safe alternative housing immediately, rather than entering shelter or experiencing unsheltered homelessness. It's intended to ensure that the homelessness experience is as brief as possible, to prevent unsheltered homelessness and to avert stays in shelter. So client-driven, our kind of goal here is to empower the client to be their decision maker in their situation and to lead a conversation, but have the client be directing that conversation and resolving their own situation with just a little guidance from us. So it's very, very light touch case management. Next slide, please. And so how does it work? It's an intensive service intervention. Again, through an interactive problem-solving conversation with the client, we seek to understand a person's housing crisis, explore what immediate solutions to the crisis may be possible, and then help them pursue a solution. The idea is to immediately get the client into a safe housing alternative, which may be a short or longer term stay. And some of those options may include a negotiated return to their previous housing, to the previous place where they were staying, a short-term non-shelter accommodation, permanent housing like an apartment or a home, or returns to family, relocating to family in some cases. Next slide, please. So some eligible activities under shelter diversion would be costs associated with move-in, so like security deposit. We also have the ability to pay up to 3 months of their rent if we help with the security deposit, so we can really help them stabilize in their permanent housing, which is really, really great. We can do family friend landlord mediation. So if someone was staying with family or friends and they were asked to leave, we're trained to be able to do some mediation with the family and friends, conflict resolution, but we can also incentivize family and friends to be able to let someone stay for a period of time while we work with them on finding housing. And that would be done through maybe paying a DTE bill or providing a grocery gift card, things like that. We can also do relocation assistance. We've actually helped 2 families relocate. One family was experiencing homelessness here in Washtenaw County, and her father lived in California and was a great support system for her, and was willing to let her stay at his house until she could get back on her feet. So it was a really good situation because she'd have a place to stay and she would have a support system. So we actually flew her partner, and their 2 children to California. We provided the flights. We also provided Uber gift cards so they could get to and from the airport successfully, and food gift cards so that they were able to eat in the airport during their layover. We also bused a family to Colorado recently where they had a friend that was willing to let them stay and help them get back on their feet. So those are some of the things that we can do with relocation, and we've been very successful. I know when we've touched base with both families, they're doing very, very well. So happy to report that. We can also do vehicle repair. So if a client needs a vehicle to continue to get to employment or to transport themselves to a relocation destination, we can help with repair and more. We have a lot of flexibility with diversion. There's quite a bit of gray area, and we've had some really complicated cases and explored a lot of different ways to pay for things. So yeah, we're very open to problem solving any complex case. And I just wanted to put it out there that we love collaborating. And for diversion, they don't have to go through Hawk first. We can take referrals directly from community partners. We don't have a formal referral process set up. I just ask that you just email me. My email is at the end of this PowerPoint presentation. You can just shoot me an email and ask to give you a call, and I'd be happy to connect and see how we can work together to help folks. Next slide, please. And why practice diversion? It's less trauma a lot of times than a family going into shelter, entering into the homeless system. At the end of the day, households want permanent housing. No matter how well a shelter is run, no matter how gorgeous, great the shelter is, like at the end of the day, the families desire and want permanent housing. And I think really important here is it's much more cost effective for communities than shelter is. So right now for our family, on the family side, I can't speak for individuals, but the average cost of diverting a household is $995 per household. So it's very cost effective, and it's helps. This, at the end of the day, what the household really wants is to be permanently housed. Next slide, please. Just a picture of me in case this is distributed amongst community partners so that they can put a face to the name, and just wanted to put a reminder that to contact me anytime. I love to connect with community partners and collaborate. Please, please, please call or email me anytime. Like I can't stress that enough. I'm not like, I want you to call me and email me, please. Like, I love connecting. I love touching base. Like, I love the most complicated cases that you can bring to me. I like to problem solve. I like a challenge. So please don't ever hesitate to reach me. On the screen is my email address, and that's my cell phone number. You can call, text. I would love to touch base and see how we can work together to help clients. I think at the end of the day, we all have one goal, and we're better when we can work together and collaborate. All right, I see some questions in the chat that I've been missing.
Yeah, I was going to pull those up here.
Okay, thank
We're
you.
done. Let's see. Here we go. Let's start up at the top. Okay. Christopher, you were asking, you say that's yearly, right? So are you referring to the 5,000 that Kara was speaking to? Do you want to unmic and talk to us about what you were asking? No.
I think it may have been the $5,000 homeless prevention cap is per like rolling calendar year. So whenever they received assistance, like the date, that's when it starts over, like the following year from the date they got assistance. But and I'll be honest with you, right now we don't even have access to even help people up to $5,000. There's just not, the funding in the community just doesn't exist right now.
Okay, we have another question. Can RRH clients use this program for car repair since they are still considered homeless?
Oh, that's a good question. Who did that come from?
Hugh?
Hugh, I'm going to call you tomorrow about something else. So I will ask Mishta and get back to you on that.
Thank you.
No problem. I'm going to call you tomorrow.
Okay. Are there any caps for car repairs?
Yes, $2,500 is the cap. But we could also, if the car repair was a little more expensive, we can work with other community funds to try to piecemeal it together too.
Am I allowed to unmute and ask a question, even though I unmuted to ask this question?
Yes. Yes, please.
Okay, my name is Sean, and I represent Wayne County Resource Champions as well as National Kidney Foundation. And Kara, I'm going to email you because I am working on, I've written these systems navigation manuals called Finding Your Way. And they go across basic needs and they teach you how to navigate systems and then understand like how to apply. Am I eligible? And I am really running into some hurdles with your whole housing and in Oakland, in Washtenaw County. I've done a book for Wayne, Oakland, Macomb. I've done on the west side and it's been pretty straightforward. And here I'm like, ooh, I'm a little confused.
Yeah,
So
please contact me.
fabuloso. And for anybody else too, if the Finding Your Way, you can find them on our NKFM if you go to our website or just type Finding Your Way NKFM so you can get an idea. But I'm going across all the basic needs and I'm just explaining how to navigate systems. It's like a recipe book for basic needs. So it's not replacing anything wonderful you're doing there. It's another tool. But if you look at it or you want to see it before I put it out, or if you're in a certain domain like housing or transportation and food, and you're like, Sean, I want to check out what you're putting in there before you publish, I am so open to that. So first off, Kara, I will be giving you an email probably tomorrow, and I will throw my email in the chat too for anybody else who wants some more information. Oh, yes. Can you put the link in the chat? Well, I'll try to do that. I'm pretty lame on this Zoom stuff myself, but here we go. Thank you.
Looking forward to
Yes,
hearing from you. Thank you.
And also, Sean, do you have access to our Barry Buster listserv? That would be another opportunity for you to post. You can always send it to me and I can pass it on, but maybe if you were interested just to post your initiative and what you're working on, just food for thought. Okay, I see that you do. Okay, great. Also, I saw here, let's see, Alicia. She is saying that if, to kind of back up everything Kara was saying, that if they, SOS, refer a family for diversion Oh, no, this is a question. I'm sorry, I'm reading this all completely wrong. This is a question. If we refer a family for diversion, but it's determined that no opportunities for diversion exist, will SOS help the family to connect with Hawk?
Yes, we would typically refer them back to Hawk. Sometimes that happens. Important to note that diversion is not always the best fit for every family. If they need a lot of intervention, it's not traditional case management. It's very, very light touch. Most of what we would do is just provide the financial assistance. It's a client-led conversation. Though if we don't think a client is an appropriate fit because there's a lot of barriers and they need more support, we would refer them back to Hawk. However, Hawk's not going to be able to provide case management. So that's kind of like where there's a gap, right? Because we don't actually really have case management for families that are unsheltered or unresourced right now.
Okay, Samara, I have something here. It says you put down, if you're potentially searching for more funding for your organization, please send me an email so we can get you a meeting set up. Do you want to tell us more about what you're referring to here?
Kara, she was saying that she doesn't, if I heard her correctly, correct me if I'm wrong, you were saying that she don't really have like the $5,000 like, to contribute towards each family or person. I don't know if you've reached out to anybody up here in Lansing yet in its budget season. So I was saying if you are potentially looking for more funding for your organization, just send me an email so that we can get you a meeting set up.
Okay. Thank you.
You're welcome.
Is there any other questions for Kara? You want to unmute and ask or put in the chat?
This is Yvonne. I don't want to put you on the spot, Kara.
You can.
I'm going to.
Okay.
I'm a little bit, I don't work directly with clients. So keep that in mind when I ask this question. If the prevention requires to get prevention assistance, one has to have a summons and a complaint for an eviction, but assessments aren't getting scheduled for, I don't know, let's just say 2 days, and then it takes 7 to 8 weeks. I mean, that's a really long time. How effective is that?
So I didn't talk about the Hawk process because that's not my area anymore, like the call center. But they'll actually schedule folks when they have that demand for possession, that 7-day notice, which is the initial document that they get before they go to court. So Hawk will actually schedule, but in order for us to assist them financially, they have to be in court proceedings.
So do they get prioritized?
Does who get prioritized?
The people who've got summons and complaints, do they get prioritized so they can get a meeting? And
we don't have a way to, we just don't have the capacity to do that right now. We just don't have enough staff. Just 2 people taking appointments for the entire county. I can't like express enough like how frustrating and hard that it's been. Like you guys know, if you know me and you've worked with me in the past, and you know that I will always be transparent and honest, and it's been very, very, very difficult. But what I will tell you is that I will disclaimer that I am not an attorney, but there are new Michigan Supreme Court rules around clients who are in the court process and adjournments when they're in the process of getting assistance. So there's several adjournments that they can be eligible for. I don't want to get too deep into it because again, like I'm not an attorney, I'm not a part of the court process, but there's a certain number of adjournments they can get if they're in the process of getting assistance.
That's great news.
Yeah.
Thanks.
Yep.
Samara adds, you're correct. Oh, we've got some more going on. I'm interested. Hi, Samara. Is this something that you wanted to do privately?
I'll let you go back.
I'm sorry, repeat that for me.
Yeah, I'm just trying to follow tracking the conversation.
Oh, okay.
Okay. It looks like somebody maybe is looking to connect with you with their consumers with financial resources. and is sending you their email. Do you, Samara, see the chat?
I do, and I do see the
okay
message. Thank you.
Yeah. All right. Any other questions? Anything for Kara? Okay.
I have a question. So if I have a client that's unhoused and has been unhoused since August, she got I guess it's called a prioritization number of 6. And I'm just wondering, she's still unhoused. I'm wondering, how do I get her, I guess, a housing intake so that possibly she can get on the Section 8 list, since there's no shelters available at this time? And then how can I access the diversion program for this client?
So I think maybe you'd want to connect with me like separately offline if it's in relation to a specific client, but I would let you know that I would have to have a release of information in order to speak about anyone specifically.
Yes, great.
But if you wanted to like
Just
send me an email, we could try to connect.
Yeah, I submitted a ROI last week for this client, so I'm hoping that it's been uploaded.
Yeah, yeah. So that may have gone to the call center.
Okay.
And we're a separate entity
Yes,
and a
ma'am.
separate organization.
Okay.
So if we're not included on that ROI, would have to have a separate one. But we can connect. If you just shoot me an email, we can connect that way.
Thank you.
Yeah.
Okay. Last call for questions. We're going to move on to the Barry Vester funding summary. Okay.
Thank you so much, everybody.
I am going to go ahead and share my screen, and I'm going to do a little update. Oh, okay. All right. So here's what we got. Everybody can see this okay? Yeah. All right. I'm
sorry, can you enlarge it?
a little bigger? Oh, that's asking a lot. Let me see. I'm going to stop sharing for a second because then I can navigate it a little quicker and easier. Let me see if I can make it. Oops. I'm zooming it here. Okay, I'm going to share again. You tell me if this works. All right. Is that bigger? Is that a little better?
Yes, thank you.
A little bit, a little bit. Okay. All right. So here's what we got. This is kind of a summary, just kind of capturing. We're going to just start from the top and we're going to work our way down, and then we're going to get to what you're all waiting to hear about. We have right now, we're currently kind of low on our Washington County flexible funds at the moment. We're going to do another, that should change come March 1st. So this Friday, Monday, we should have our 14,000 that will be moving into it, that we'll have for the month of March. So things did get a little tight these last 2 weeks for the general flexible fund. So that'll be coming. So we'll have available funds for that. We also have the Ypsilanti Township Fund. We do have about 30,000 that's accessible. Keep in mind, it's only for township residents only. Always check. You can go, if you go to Barry Vester's member resource page, on there is a link to Map Washtenaw, and you can go in and check that and double check that they're in Ypsilanti Township. For those of you that are making requests and you're requesting these funds, put that down in the narrative that, Ypsilanti Township client, put that in there. all the information in that narrative helps us go through the process quicker. Now, the next one is the Homelessness, Housing, and Immediate Impact Fund. Some of you may have heard about this. I just want to preface about this that I am not in a position right now to discuss a lot of details about this. So we're going to save those questions that you have specifically for this fund for the trainings that'll occur, yes, on Friday, and then the several other dates that we have set up. What I will say as far as the training, I know there was a question earlier about when those links haven't been sent out. Nope, they haven't. I will be sending them out hopefully today or likely tomorrow morning. So yeah, a little last minute, but this whole thing is rolling out really quickly. And so there's a lot of things we got to get in order. But you will receive a link for those of you that are set for Friday morning. We'll get you a link set up. Either today or tomorrow morning. And then the links will come for those other training sessions that you may have signed up for. They'll come also. The next one, we do have the Ann Arbor Water Utility Assistance that's rolling. That's always in existence. But always keep in mind, check the map Washtenaw, make sure they're Ann Arbor, City of Ann Arbor as their water provider, and that they're in the City of Ann Arbor. So I kind of did kind of an approximation of about 500,000 available with this nice bucket of money right here. Things just to know how this runs is, each month we're going to kind of allocate. So each month we'll be moving over that 14.5 to general funds, the 16,000 over to township. One thing I can add in here that's not listed in this, because this does not run through Encompass. This is the LIWAP, Low Income Household Water Assistance Program. This program is the one that I'm running and supporting, and you'll want to contact me directly if you have a client or questions about the program. You can access this information. You can pass it on to clients. It is for the clients, the community members themselves to apply and to work directly with me. You can help them out. But you can go to our website on the county website, put this in, and it'll come up. It'll give all the criteria for the program, the link for the form stack application, and the documents that all need to be uploaded. This program has about $18,000 right now for the month of March. And then at the end of March 31st, the program ends. So if you know anybody who needs that water assistance, as long as they pay their water to a water provider, not a landlord, most of our water providers in Washtenaw County are in contract with us so that we can use LIWAP funds with. So that's the caveat there, is it can't go directly to rental agencies or landlords, but it can go to water providers. So any questions that aren't too heavy into the high funds, but any questions about this that I can help answer? Let me check our chat up here. Do other counties have access to something similar to High Fund, or is this exclusively Washtenaw County? So I can just speak to that one. This one is specifically for Washtenaw County. It's coming from ARP funds, and this is how the county is distributing some of that funding. So it is specific to Washtenaw County.
Are you able to send this to me via email?
I'm sorry, say that again. Am I able to what?
Can you send this to me through email, this barrier busters current funding?
Yeah, to get this list? Sure.
Yes. Thank you.
We also, we're starting to put it up. So if you were to go to our website and go to, if you go to the Barrier Busters Washtenaw County website, under the resource page, you'll see that there is a funding. My goal is to get that updated every week or when things change. So you can also access it there too, but to keep everybody up to date on where we are with funds.
Okay, thank you.
Mm-hmm. Any other questions? Let's see, where'd my chat go? All right, I'm not seeing anything in chat. Okay. Well, I will, if this is it and everyone's feeling ready to adjourn, we can call it an end. And for those of it, yep, did I hear somebody?
It's Marty. I just wanted to give you a major thank you, Stacy, for all that you've done in the last couple of weeks with the high funds coming in and the work that you've done to put all of this together. You guys have no idea what this woman has gone through to make this stuff available to you guys. I just think you need to know that because some great things are happening and she has been behind doing some amazing stuff for you guys. So just want you to know that.
Thank you for the shout out, Marty. Yeah. Yeah. And that really goes too for the whole team. We're all trying to get it all in line. So yeah. Was there any other questions or anything else I can address? Sounds like we're good. Okay, then I'm going to let you all go and I'm going to go back and work on getting that list together and get these invites for the training sent out to everyone. Okay.
Thank you so much.
Yep. Have a great day.
Thanks, Stacy.
Yep.
Thank you.
You bet.
Thank you.
Have a great day.
Thanks. Bye.
Bye-bye. Thank you.
Bye, all.
Right.